Hello, everybody. My name is Brooke Belay. I'm one of the admissions advisors here at the Dr. Sears Wellness Institute. I'm super excited you're here with us today. We're going to dive all into health coaching and our different certification programs that we offer for you. You'll be hearing from the experts. So we've got people in our health and wellness industry, the instructors that are going to talk to you about all our different offerings today. We're going to kick it off with Cedric Bryant. He's going to dive all into the health coaching industry. What are the opportunities after your training, and what does the field look like, and where is it going? So Cedric, take it away.
I'm Dr. Cedric Bryant. I'm the Chief Science Officer and President for the American Council on Exercise. I have been with the organization for 20 plus years, and my career has really spanned a lot of work with regard to public health, exercise physiology, exercise science, and really the nexus or connection between those two. And that's really where the whole discipline of health coaching really comes into play, and that health coaching really bridges the clinical and science aspects of knowledge and learning into really kind of connecting it to the community and really producing those outcomes on an individual as well as a community-wide basis. And so in my opinion, health coaching really is the next frontier for us really affecting significant, important change as it relates to public health. Because at its core, health coaching is a personalized, collaborative approach to helping individuals lead healthier, better lives, and just really kind of their pursuit of kind of optimizing their abilities to be healthy and well. And what occurs in health coaching is that you have an appropriately trained professional, the health coach, who works with individuals to set and track health goals, to develop healthier habits, to make sustainable lifestyle changes, which all really result in them living those healthier lifestyles and really experiencing better well-being. And they will cover on a variety of topics that can range from nutrition, physical activity, stress management, sleep quality, avoidance of unhealthy substances and so forth. So it really covers that kind of wellness gamut, if you will, in terms of types of activities that will be addressed. And the reason why health coaches are so needed is because, quite frankly, change is hard. Behavior change is extremely difficult because most of us have ambivalence when it comes to change. If we were to survey 10 people and we were to ask them, do you think being physically active on a regular basis, following a healthy eating plan, managing your stress, are all those things important and we should be doing them? If we interviewed 10 people, I would say probably all 10 of those individuals would say yes to that question. You might get the one contrarian who might say no, but largely everyone's going to say yes. If I were to pose a different question to those same 10 individuals, and that is, how many of you are doing those things on a regular basis? Probably only one or two could honestly say yes. So what is responsible for that disconnect between what we know and believe we should be doing versus what we actually do? And that's really health coaching. Health coaching is what bridges that divide between all this knowledge we have in terms of what we should be doing and what we actually do. The health coach is that trusted partner who comes alongside individuals to help them navigate that really challenging journey of change. And they do this by using techniques to help individuals to identify what are the particular challenges or obstacles to them being able to change. What things have they been able to do in their past where they could be successful in bringing about these changes? And the health coach helps the individual identify their strengths and be able to build on and utilize those strengths to bring about these small, consistent changes that result in these big positive outcomes. And so if we're really going to move the needle toward having a healthier lifestyle, improving population health, health coaches are going to be at the center of core of that change. because they really are going to be those trusted partners that are going to facilitate this change. They're going to be those change agents. Things that public health agencies and organizations are saying, healthcare is saying, is that in order to help their patients and their clients and their communities to have better health outcomes, it requires them to be able to effectively change their lifestyles. And that's where the health coach is really going to be that person who can help them with the facilitation of that change, to empower the individuals, to give them those necessary tools and skills to be able to make those all important changes. And so the future is bright in that. I believe, humbly speaking, that health coaches are really going to become an integral part of what I'd call the optimal healthcare team. In that really optimal healthcare truly is the ultimate team sport, where you have different players playing different positions for this shared outcome, and that is to help people lead their healthier, best lives. The real beauty of the content that we have to offer under the DSWI brand is the life stage approach that it takes, where you can have content that is specifically focused on working and helping families to make those important changes and improve lifestyle. We have content that is focused on pregnancy. We have content that's focused on adults. So we're able to cover the entire spectrum of individuals' needs to really help them become and be their best selves.
So one of the common questions we get is, what is the difference between all our different certifications and trainings that we offer? We offer 3 initial health coach certifications broken up into life stages: families, pregnancy, and adults and seniors. We also offer a master health coach certification. So if you're looking to take your coaching to the next level, that would be in our master training. We're going to dive into all the different life stages so you can really get a look and a feel for how each life stage is going to be. Now we're going to start with Monica. She is our families instructor.
Really, as the name implies, it teaches our students to work with families on how to create healthy habits with their kids from the start. And while it is geared toward families with young kids, it really is the foundation for anything that any of the information that anybody needs to build that healthy lifestyle. So it's the foundation on lifestyle, the foundation on nutrition. So we do tell our students that their clients don't have to have kids to benefit from the family's curriculum. It's really going to benefit anybody who's healthy. And the other curriculums, as they will hear from the other instructors, are designed to help people in sort of acute phases of life. Our families, that curriculum, it doesn't matter if they're 8 months or 80. If somebody is in good health, it's really the foundation. And make no mistake, by foundation, I don't mean it's basic. It is wonderful information that anybody needs to get started on a healthy journey. As far as what students learn in the families course, we start with the basics of what we call traffic light eating, which is a fun and interactive way to just take the guesswork out of what foods to eat and what healthy eating looks like. We talk about how to put together a healthy breakfast, especially for kids when we're sending them off to school, hoping that they're doing their best learning and on their best behavior. We talk about taking the guesswork out of how to choose the right carbohydrates so that we're not eating junk carbs. We talk about veggies and fruit and fiber, about physical activity, about water, what to drink, what not to drink, how to stay hydrated and keep out of being dehydrated. Really exciting. It's fun. It's interactive. We teach students how to coach both online and in person. We teach students how to coach both groups, large and small, as well as sitting with just an individual one-on-one. They get a really great foundation in how to coach their clients. Working with a live instructor is really one of the cornerstones of our program. And students will find that the instructors love being there with them. It's definitely my favorite part of my job when I have my days that I teach live and I get to interact with my students. Coming to live class is a really valuable experience for our students. Not only are they getting that information in real time, but they can stop and ask questions. They can ask for a review of information if there's something that they didn't quite grasp. And then they get to start networking with each other as well. Not only are they there to get questions answered and gain information from their instructor, but it's the first place that they start that professional network of coaches. And what we recommend when they move into their coaching careers is having that professional network. We always need someone as coaches to bounce ideas off of. Am I handling things correctly with this client? Or someone to just sort of call at the end of a tough day sometimes and to vent and talk things through. And that those live classes is really where they begin that journey of connecting with other coaches. It's a really valuable experience for them to be in live class. With the families course, one of the things that is the most exciting is that there is content that's applicable for our students, and they can utilize that content and those tools that they're receiving right away. One of the things that they receive through training with us is PowerPoint presentations that have been professionally designed directly for their use with their clients. They have full scripting on all of the slides. They have coach notes. They have links to where all of that information came from. And our coaches can graduate and utilize that information to start helping clients right away.
Thank you, Monica. It's really great to get a glimpse into everything you're learning in the families training. I remember when I was going through the certification, I took the families training with Monica, and she was so passionate, and it inspired me as a coach. Every time we were on the Zoom call with her, her face just lit up, and we got to talk about all the different health and wellness topics. It was just really exciting to see that someone else shared the passion that I had for coaching and teaching people all the health and wellness topics. Our next life stage course we're going to talk about today is our adults and seniors. Anne is going to take us through all the content that you will learn in this course.
So my name is Anne Herzberg, and I'm a nationally board certified health and wellness coach. I am also a licensed respiratory therapist and a certified functional nutrition counselor. And I teach the 6-week adult and seniors health coach certification course. So I really enjoy empowering our students to help others implement changes in their lives to improve their overall health. So I guess you could say that I kind of get to experience the helper's high pretty frequently. So just overview a little bit of our adults and seniors course curriculum, because in this course, our students learn to empower their clients with information that can improve their brain function, boost energy levels, prevent age-related diseases, and generally take charge of their overall health. So we refer to prime time. We have the prime time health book. We refer to prime time as basically the second half of life. And what's that going to look like for you? So students are going to walk away from our course with a series of 4 ready-made presentations that are going to revolutionize the way their clients think about eating and moving and thinking. And many people want to live a long life that's free of pain, free of illness. They just don't know where to start. And these sessions are science-driven, fun, and easy for the clients to digest. So our coaches are able to guide them to find their why. We go into so many different science-based reasons. We talk about the impact that nutrition has on the brain, which is a really important thing right now, especially in prime time health, how it impacts the brain down to a cellular level. And we get into the effects of inflammation and its overall effect on our health, how it's the root cause of most age-related illnesses. And we educate on how food and exercise can help reduce inflammation. We also talk about the real relationship of blood sugar to heart disease. So our students learn that it's never too late to make baby steps in changing the way we eat, the way we move, and the way we think for a healthier, happier, more fulfilling prime time. We want them to impart the knowledge of health span over lifespan. My favorite part is teaching them how to guide their clients into finding their why and how to elicit that information from the clients, and the use of their interviewing skills using open questions and really getting to the heart of the client's why. Something that I've really heard from our former students, they have to do a live session presentation in order to graduate from the course. And many people, that's kind of a daunting task because you have to present a PowerPoint presentation. And what I hear from the students that after they've actually done it is they, not only their participants in the live session, but even themselves, they get that aha, either of what they're teaching or the aha that they're in the right place and they're doing what they love and they're making a difference in people's lives. The future of health coaching is bright, with the number of baby boomers that we have and just the population that is approaching prime time and the difference that we can come in and make. We are the key. We're able to educate, we're able to guide, we're able to offer scientific research on all of these topics and walk the walk with our clients in a way that the medical community doesn't really have the time to do. And so I really feel like we're that missing link. And it's only going to get bigger and have a bigger need for health coaching going forward.
Thank you, Anne. What I really love about the adults and seniors course is we cover every topic that us adults face, right? Stress, healthy, sustainable weight loss, chronic disease, management, you name it, we all face it. And what really is great about this course is it's never too late to start living a healthier lifestyle. And we're going to learn all of that in the adults and seniors course. Our next life stage we're going to dive into is pregnancy. Now, pregnancy is definitely a special time in someone's life, and have a health coach certification that can help pregnant women in this season is really invaluable. It's taught none other than Rachel. She is one of our instructors, and she does all the pregnancy related health coach certifications.
My name is Rachel Bayer, and I teach the pregnancy courses and the adults and seniors course at the Dr. Sears Wellness Institute. Prior to that, my background is actually as a registered nurse. I have been in the nursing field for over 19 years, and most of that time has been spent in the OB/GYN arena. So I've worked labor and delivery, worked in doctor's offices, and also teaching out in the community. So I did a lot of childbirth education classes in my local hospital, and then out in the real world educating moms and dads and everybody, and helping them learn more about how to be healthy when they're pregnant, and then moving into postpartum as well. So some of the highlights with our pregnancy course that I think makes us unique is that we take a holistic approach. We really focus on the 4 pillars of health: lifestyle, exercise, attitude, and nutrition. And in the focus of a pregnancy lens, we really put that into perspective on why that's important for our moms as they're going through pregnancy, and actually even when they are thinking about becoming pregnant, because we know that diet and lifestyle have huge influences. We call that the epigenetic effect. And so we talk about that in our classes and how it's really important if we can get those changes taken care of ahead of time before moms are even pregnant. But even if they are pregnant and they haven't made those changes yet, we give them the tools and the resources. We have lots of helpful handouts that we like to share with our clients, even things like the top pregnancy superfoods handout, just to really make things simple and easy for them to make those changes in their lives one step at a time. So a lot of people ask about epigenetics. It's kind of a buzzword out there in the world these days. And so we do talk about that in our pregnancy courses. So epigenetics is how our behaviors and our environment influence our genes. So many people think that if they have a gene for something, that they're just destined to come down with that disorder, but that's actually not true. Our environment really impacts what happens in our lives, and that's why nutrition and lifestyle is so important. So particularly during pregnancy, the baby is influenced by what the mom is consuming and her environment around her. So if she can be healthy and make those changes early, then that will really play into what happens later in life with that baby. It can even turn on genes that are going to make that baby more prone to things like diabetes and heart disease. So it really can impact the baby. So we're actually finding out that when you're pregnant, you are actually exposing 3 generations of people. So it's the pregnant mom herself, then the baby inside of her, and then those sex organs inside the baby. So it's 3 generations that are affected, which I think a lot of people aren't aware of. And when they become aware of that, they want to make those changes. So the pregnancy courses that we teach really lend themselves to allowing coaches to help all kinds of different people, and they can coach groups of individuals and also individual people themselves. So one of the things that is really wonderful about pregnancy is that we need a tribe, we need a community of people, because it's a stressful time for many. It's a crazy time. Moms and dads are anxious about learning, and they don't know who to turn to. And sometimes they even get too much unsolicited advice. And so what's really great about being coached in a group is that you have that ready-made cohort of people that are going through that experience at the exact same time as you are. So you can bounce ideas off easily with each other. And then on the flip side, after they complete their pregnancy, they have a ready-made group of postpartum support people. And that is another crucial time where we really rely on people after the birth of the baby to help us through those really challenging times. So one of the best things about group coaching is that you get that group of people before pregnancy, during pregnancy, after pregnancy. And I know I'm good friends with people that I've gone through classes with during pregnancy, even years later, because we still have that common bond of going through that pregnancy at that time. But pregnancy coaching can also be very wonderful for individuals as well. So you can just assess your community and what those needs are. And that's what's so great about coaching, is that there are endless opportunities that you have available. So we have many different birth professionals out there in the world, and oftentimes we're looking to expand our knowledge. I know when I worked in this space as a nurse, I still felt like I was missing some of these essential tools. And so that's what this pregnancy curriculum brings. We bring that approach of not just thinking in those medical terms, but in that holistic term. So you're going to learn in this course about environmental chemicals and how that impacts your body. You're going to learn about food and nutrition. Unfortunately, our providers oftentimes don't have a lot of time to really talk about the importance of protein and healthy fats and vitamins and minerals, and how to choose a prenatal vitamin, because there are like 250 out there on the market today. And many times doctors or nurses might just say, we'll take a prenatal, but you don't know what to look for. So our course will help educate you on that. We will help you write a postpartum plan. So many times we think about writing a birth plan, and doulas help with writing a birth plan. But then when it gets to postpartum, we don't know what to do. We don't have a plan. And so we're scrambling and we're stressed and we're tired. So this course, we actually help you write a plan to make sure that your clients are eating right and exercising and resting and getting help. So those are just some of the tools that we provide in our course, but we really try to put it in action for you by giving you those readily accessible things that you can use with your clients.
All right, now that we've learned about our life stages, let's dive into our Master Health Coach certification. So our Master Health Coach certification is really where you take your coaching to the next level. We dive into the psychology behind behavior change, really the science behind behavior change. It's one thing to know the health and wellness topics. It's a whole other thing to coach your clients. How do we motivate them to make these changes that instill a healthier lifestyle? So within the master training, it's very hands-on, very practical, and we learn all these advanced coaching techniques that really level up your health coaching expertise. So Anna's going to take it away and tell us all about our master training.
I am Anna Laidlaw. I'm a master certified health coach through the Dr. Sears Wellness Institute. I'm also a national board certified health and wellness coach. So in the master training program, our students are learning those advanced skills and techniques through a live, interactive, instructor-led course. And we really focus on the psychology of behavior change. So we help students develop and hone those advanced skills to work with a diverse client base across the entire change spectrum. Our course content also covers all of the competencies on the National Board of Health and Wellness Coaching exam outline. So once you successfully complete our master course, you will have fulfilled the requirement, the training requirement to sit for the national board exam. So let me start with some high-level features, and then I'll get into some details around what you can expect from the Master Health Coach training course. So first of all, we have a 24/7 live interactive classroom loaded with resources and a forum for interaction. And then the course itself is divided into two parts. So part one is a 24-week instructor-led course. There are 2-hour live classes each week. There is extensive instructor and peer interaction within those classes. We also have weekly lessons, quizzes, health and wellness content, and some of your lessons will involve recorded volunteer client interactions, recording segments of a health coaching program. Part two is our PSA, the Practical Skills Assessment. It's a self-paced assessment that serves as our final exam, and students will conduct a mini coaching program over 4 recorded sessions. And then throughout this whole time, students will have the support of the Dr. Sears Wellness Institute instructor team, our staff, and to support them during the whole course and beyond. So there are so many rewarding parts of being an instructor for the Master Health Coach training program. One, I get to know students over the 24 weeks of our intensive training. So I'm really developing relationships with each of my students, getting to know their unique skills and backgrounds and the niche they want to go into. And it allows me to provide them with that customized individual support, guidance that I can work into our classes and our lessons, as well as in our individual feedback sessions, which we eventually do have as part of part 2 of our course. So it's just taking a step back to some of the content in our part 1 over the 24 weeks. There are so many favorite classes that I love to teach, but I love how the course starts at the very beginning with Health Coach Basics. And then we focus on the techniques and theories for sustained behavior change. And this is where we get into some of our evidence-based communication techniques, like compassionate communication and appreciative inquiry and motivational interviewing. The course then moves on to giving students the tools and the resources and the strategies they need to take their clients through a whole coaching program. And so we learn about these tools and resources and then actually apply them in our lessons each week and in class with small peer group practice. And then it's time to bring it all together. So during our last 8 sessions of the course, we spend a lot of time in our small groups practicing an entire coaching program, bringing everything we've learned together so that students are ready to embark on their 12-week practical skills assessment successfully. I mean, the National Board of Health and Wellness Coaching credential is the most well-known credential in our field because it was established in conjunction with the National Board of Medical Examiners. It really does lend that credibility to the field. And so it's a rigorous training program that requires practical experience as well. So, coaches with the credential are tending to be considered for more opportunities because they have that rigorous training. People don't like being told what to do. And oftentimes our best intentions to give advice, we call it being a director, it backfires. And what we do in the master course is, we teach our coaches how to effectively deliver this information, help our clients discover their own reasons why they should want the information, use the information, how it could change their individual unique lives. And we in that way let the client lead the way. We even have a segment of our training where we teach a specific communication technique called respectful informing that helps our coaches understand how to best deliver information to clients so that it's not overwhelming, so that it's tailored to the client, so that we can ensure understanding. It's teaching our coaches how to have conversation with their clients rather than delivering a lecture. And so we can see from the beginning of the course to the end that growth in our coaches and that change in their communication style. And the feedback is that it really works. It is very effective. One of the greatest benefits is that students are in a class with such a diverse peer group. So we have students who are medical and healthcare professionals, nurses, doctors, chiropractors. Some are in the wellness sphere, massage therapists, acupuncturists, but we also have corporate career changers, just like I was when I went through the course. We have people who have not been in the workforce for a long time and are just coming in to the workforce because they're inspired by health coaching, or perhaps they've experienced a big health change themselves. And then certainly we have coaches who are currently working for companies. So they have that experience and their companies have sent them to the course and they offer a totally different perspective. So it is really exciting to bring all of these individuals together. And then their client base is also so unique. We have coaches who are coaching in their local communities. We have coaches who are in the prison system, coaching incarcerated clients. We have coaches in the healthcare and wellness sphere, coaching patients through recovery or addiction. I mean, it really runs the whole gamut, and it's just fascinating on how much our students can support each other and broaden one another's perspectives in our class through this time that we spend together. We ask our students for feedback after each trimester, and especially our students who establish coaching practices right after their life stage courses and have been very successful. Even their feedback is, after taking the master course, is that they wish they had done it sooner because it's only enhancing the outcomes for their clients. And so their feedback is really meaningful because they're out there, as practicing coaches. So that is one, I guess, piece of advice is, don't wait. And this course, we also get the feedback that not only with your clients, but with your relationships in your own life, it really does change the way you can communicate with family, with loved ones. And so it has applications to every aspect of our coaches' lives.
Thank you, Anna. One thing that's really great about the Master Health Coach certification is you become a better coach in so many different aspects. So whether your background is in nursing or personal training, health coaching, and having that master level of all these advanced coaching skills is just going to help you relate to your clients more and really see that positive impact in their life. So we covered a lot today. We went through all our courses. It's a lot of information to digest, and everyone has their own health coaching journey. Just know that we are here every step of the way. If you have additional questions or want to connect, just give us a call. We'd be happy to talk with you and get you in the right training program. If you're ready to go, online registration is now open, and we can't wait to see you in the next class.